Now, in order to live safely with COVID-19, we have to adhere with SOP diligently. Also, what is becoming the next normal is getting COVID-19 tests and home isolation, should you be advised to. However, do we know enough about the differences between the COVID-19 tests available in the country and how to choose one that is right for us? Home isolation seems like a simple idea, but is it? So what are the guidelines? Today, I will be speaking with Professor Dr. James Koh, Head of Division of Medicine, School of Medicine, International Medical University, to lay it all out. Prof James is, of course, infectious disease physician. Like many other physicians, Prof James has become involved and become part of the team to fight COVID pandemic. Today, Prof James will help us understand COVID-19 testings, the type, accuracies, and methods, and as well as guide for us to practice home isolation if we need to. First of all, hi, Prof. Thank you so much. Good afternoon. Thank you so much for joining us.
Pleasure.
Okay, so let's start with a quick overview of COVID-19 testing. What are the types of COVID-19 testing available in the country?
Okay, for the moment, we have 3 types of tests in the country, right? Out of which 2 of them are for the purpose of diagnosis, meaning you want to find out whether you have been infected with COVID-19. I think most of us have heard of the test called PCR test. PCR stands for polymerase chain reaction. Right? It is a test that is designed to pick up the genetic material of the virus, right? And then we use a machine to amplify that genetic material for detection purpose, right? So this is the most sensitive and most accurate test that we have. Now, the drawback is that it has to be done in a center by trained personnel. The sampling that they will use is from the nasopharyngeal sample, meaning right back from the back of your throat. I think those of you who have had the test before, you will know that it's not a very pleasant experience, getting a stick poked right up there. I've got a few done myself, not pleasant at all. But that's the place where they get the sample, and with that, they will do the testing, and usually takes about 24 to 48 hours for the results to be available. Now, this test is highly accurate, but it's also the most expensive test that we have. It costs somewhere between 200 to 300 ringgit per test. Right? Now, there's another test called the Rtk Antigen Test. Similarly, this testing has to be done with people who are trained as well, and they will also take the sample, right? Same thing, from the nasopharyngeal or the oral cavity using a stick again. But the difference between this test and the other test is that you get the result really quickly. Within 15 to 30 minutes, the results will be available, right? It's so much cheaper. It's about 1/3 of the price of a PCR. But you have to balance between these 2, because the Rtk antigen test, although we can use it to discover a person has or has not been infected with the COVID-19 virus, we do have to bear in mind that it is not as accurate as the PCR, right? So generally, anyone who has been tested positive using an Rtk antigen test would then have to go further and do a PCR test to confirm that they actually have the infection. And in the last 2 weeks, I think if you follow up with the news, the government has approved several test kits, and this is a novel thing, new thing, because now you can do it on your own, and the sample is from the saliva. Fairly easy, no more stick going up the nose and all that. You do it on your own. The instructions are fairly simple. I'll show you afterwards, and the results can be obtained within 20 minutes. But similarly, together, just like the Rtk antigen test, if you get a positive test, it's just merely a screening test. Again, you have to reconfirm. If you want to know really, are you really infected with COVID? Again, the PCR test is the one to go for. But this one has its use because you can do it on your own. You don't need to a trained personnel to do it. But later I'll show you what are the things that you probably need to watch out for when doing this test. And this test is much cheaper. It's about 30 to 40 ringgit per test.
Great. I'm sure many people are a bit relieved that, tests have become more accessible now. Now, of course, between the pleasant and the unpleasant, nasal or oral. So how do we choose which one to go for though? Yeah, of course, that I've mentioned, if you really want a highly accurate and, that will confirm whether you have the infection or not, then you may have to bear with a bit of unpleasantness to go for the PCR or even the Rtk antigen, right? I'd like to introduce two specific terms that we use among the scientists. Scientists use a lot of language that most of people don't understand what's going on. So this term is called sensitive and specific, right? So what do you mean by sensitive and specific? So if a test is sensitive, it's able to detect that you are positive when you have the infection. That's sensitive. And if I say the test is specific, it tells you that you don't have the infection, right? So there are two sides to a coin, right? Maybe to make it easier for everyone to understand is, imagine you are on a honeymoon at the beach with your newly married spouse. You are deeply in love and you're walking alone, watching the sunset, and your spouse come up from behind you and just hold your hand, right? Don't jump, just hold your hand. And then if you are sensitive, if you're really sensitive, you know that that's the hand of your partner or your spouse. And if you are specific, you know that's not the hand of your partner. All right. So 100% sensitive, 100% specific would be the ideal. We don't want somebody who has your hand holding and you don't know whether it's your partner or not, and that would be quite scary actually, right? So similar with the antigen tests and PCR tests, we want tests that are very highly sensitive, very highly specific, meaning they are able to tell you whether you are infected with the virus or not, and at the same time also tell you when you are not infected with the virus. All right. So if you look at literature, most of the tests come with a little tiny manual which we always chuck away. But if you read that, you will realize that all the tests that we have, PCR, Rtk antigen, the salivary tests, all have sensitivity and specificity above 90%. So that's pretty good. Some of them have even specificity above, not above, at 100%. Pretty good, right? But I do need to caution people who want to use the salivary test that there's a concept, maybe a little bit difficult for everyone to understand, but this type of test, the screening tests that we use, are likely to be more accurate when there are a lot of infection going around in the community, right? And it is less accurate if there are only sporadic, very few infections in the community. This is a concept a little bit hard to understand, but just bear this in mind. But at this present moment in Malaysia, we're having like 20,000 yesterday cases. 4 or 5 states, including my state in Negeri Sembilan, more than 1,000. So definitely there are a lot of cases in the community, and that's when at this type of scenario, this kind of salivary test would be quite useful, and the accuracy could be better, could be quite good in this kind of setting. So I don't have time to go into that detail of why the community, if there's a lot of prevalence, there's another term that confuses everyone. If the prevalence of a lot of cases are there in the community, the tests become more accurate, right? Right. So that's good to know. Now, Prof, you mentioned that about accuracy. So does it mean that the tests are only designed to pick out COVID-19 virus or any other pathogens too? Right. Most of these type of tests are actually designed specifically for the virus, right? Like the PCR, they just detect the genetic material of that virus, and antigen detects the antigen. Antigen is the protein that is present on the virus. Most of the antigen tests that we have detects the spikes on the virus, right? And so yeah, it's designed or created to detect or very specific. They want to know or sensitive
to that protein or that genetic material. That said, there are some tests that actually combine. There's one test called Long-C from China, which is also approved by Ministry of Health, where not only it detects the COVID virus, it also detects influenza. And you can see the benefit of that because the symptoms of influenza and COVID are quite similar. Sometimes you are not able to tell them apart. So having a test that detects two viruses may have some benefits. But most of the other tests just detect COVID. Yeah.
Right. Okay. So of course, now that we know that about testings and the types, now that we have MySejahtera, many people sometimes get an alert that you have become a casual contact or close contact. Now, should you rush to get your test done, or what are the rules in terms of timing to get the test done?
Right. Okay. There are two things that we have to be aware of. If you're a casual contact, it just means that you were at a place where at any point of time, somebody who was there at the same place when you scanned your MySejahtera was subsequently detected as positive. So they are casual contact. We can't really tell whether you are actually, you could have been there 1 hour later, right? So you will be a casual contact. Whereas a close contact would be somebody, we have a very clear definition of what is a close contact presently by WHO and the Ministry of Health, in that you have to be in very close contact, means very near proximity to that person of less than 1 meter, and for a duration of time more than 15 minutes. So that's called close contact. I foresee they may actually change this definition because the Delta variant, we know that is highly transmittable, and we know that the virus is airborne. So there may be changes, but at the moment, that is our definition of close contact. So if you are told you are a close contact, then, or even a casual contact, you panic, you become very jinjang, So the first thing you want to do is like, I'm going to jump and let's buy a kit and let's do it, and see whether I'm positive or not. So that's the first thing I think every human being will want to do. Am I affected? Am I infected or not? But I think we need to calm down and then really think of two things. One is that you have to ask yourself, this is based on, say, MySejahtera, or even your friend telling you or your colleague telling you, look, I'm sorry, or text you and say, I've been detected positive, right? And today I got detected positive. So you got to ask yourself, when was the last time I met this chap? Or when was the last time I was in close proximity to this person, right? A good guide would be, try to think of 5 days, 2 days before and 3 days after the person. Just say the person told you, say on Monday, I'm positive, and today is already Thursday, right? You're asking, well, Saturday, where was I? And then up to Wednesday or Thursday today, where was I? Was I in close contact with the person? That will be a good guide, because this will be the area where the person is most highly infectious, may have a higher chance of transmitting it to somebody else, right? Now, after you got that information, the next thing you ask yourself is, when was the last time I was in contact with a person? Say this chap say, well, Monday I was tested positive, right? And so, well, he maybe didn't turn up. You were there with him on Monday morning, having breakfast or something, right? And today is Thursday. So Thursday, so Monday, Tuesday, Wednesday, Thursday. This is the third day, right? So you ask yourself that. So the best time to do all these tests would be between 3 to 5 days of the exposure, right? That will give you the best accuracy. If you do the test too early, right? For instance, if I knew today, he tells me he's positive this morning, and I jump and I do the test this afternoon, I will get a negative test because there's just not enough. Even though I'm infected, there may not be a lot of viruses in my system to give you a positive test. You end up having a false negative test. Your result came back as negative. Then you're happy, you go, oh no, I don't have the virus. Oh, thank God, So then you go out and you don't test yourself anymore, and maybe you don't have symptoms, but you're actually infected and you can spread the virus around, right? So yeah, a good time would be 3 to 5 days after the exposure.
Right. So for the benefit of our audience, when you get flagged or you learned of someone that you have come in close contact with who was tested positive, pause and count the number of days. So it's 2 days before, 3 days after you met this person, right? So that, you know, to avoid getting a false positive or false negative, right? So next, of course, the topic of today's is about doing RTK testing. Let's just understand a little bit more, since now RTK has become available on the shelves.
Yeah.
What is the protocol to use the RTK correctly at home?
Okay, just imagine I want to do my test today. One thing I need to maybe emphasize is, if you have symptoms, that will be the best time to do the test, right? So basically, who should be doing the test? One, if you are identified as a close contact, and two, if you have symptoms. Symptoms of COVID will include having fever, cough, you know, unable to, or difficulty in breathing. That will not be so good, and body aches, diarrhea. You can't smell. You can't, when you eat something, you can't taste. Those are symptoms of COVID, and you have them. It would be good because your test will likely become positive, more accurate, compared to somebody who is has no contact and maybe just curious to know whether he is positive or not. Then the test may not give you a accurate test. All right. So if you are symptomatic, that'll be the best time to do it. Now you can get all these tests from the pharmacy. They cost about 30 to 40 ringgit per test. So I have one in with me now. There's one that is approved by the MOH. Right at the back, you can see a QR code, and it's very good. You can actually scan it and watch a video on how to do it. I've watched it a couple of times and I still did it wrong. That shows how difficult for an elderly person to learn new things. So anyway, so yeah, but I learned it anyhow. And so inside the test, there are a few things. There's a funnel here. There's a plastic test tube, and if you watch carefully, there's some reagent inside there. Okay, this reagent is meant to interact with the saliva and split out the viral protein for detection. All right. So 30 minutes before the test. Oh, before that, find a place that is you know, you won't be disrupted. You'll be trying to speak, and then suddenly your kid comes in or your pet dog comes in. Will be very difficult. So make sure you can do it alone. And if you need somebody to assist you, usually this test can be done on your own, but if you need somebody to assist you, that person should probably wear some protection, like a mask, a face shield, and some apron and glove up. Might be good, because potentially you could be positive and that person is negative, and while you're doing the test, that person can be infected, right? So 30 minutes before the test, rinse the mouth. If you're a smoker, just refrain from smoking, right? And then when you're ready to do the test, make sure you have a timer, a smartwatch, or your phone around, because you need to set the time, right? Take out the stuff from the box, and I told you there's a funnel and the test tube. Open the cover and stick it in. Put some saliva inside, up to a quarter of the tube. All right. Take out the funnel. Put in the cover. All right. There's a cover here. It's a dropper cover. Put it tightly, and then squeeze the bottom for about 20 times. Shake it 20 times. Maybe sing a nursery rhyme 20 times. Okay. And then start the timer for 5 minutes. There's a hole at the box there where you can just put it in to stand, right? For 5 minutes. This is the time where the reagent here will try to mix with react with the antigen if there's a virus in your saliva, right? After that time, right, take out the test kit. It's a bit like a pregnancy test kit. I'm sure if you watch enough Korean drama, you'll see this type of test kits. Okay, open it, and it looks exactly like a pregnancy test kit, right? After 5 minutes from the dropper, put 4 drops onto the test kit, right? And then set the timer for 15 minutes and wait. During that time, maybe if there's spillage or anything, just clean up that area properly, right? The funnel, there's a little bag in the box where you can put all the disposed things, like the funnel has been used, put it inside. Don't wash and reuse and all that. No recycling allowed, right? Just put it inside. At 15 minutes, you will be able to read the test. But generally, if you have 2 lines there, just like pregnancy test, you're positive. right? If you have one line only, then you are negative. But sometimes there may be no lines at all, right? Or maybe that there's a C and the T line is positive, the C line is negative. It's also an invalid test. So what may be the reason? Well, maybe the test has got something wrong inside, expired, or the reagents are poor, or no, or maybe you didn't do it properly, right? The not enough saliva, or didn't do the proper shaking, or you didn't read it at the appropriate time. You have to read the test at 15 minutes and not beyond 20 minutes. So the timing is very important. You see the lines at 15 minutes, then that's your result. All right. If there's you return as an invalid test, you may want to consider maybe repeating the test if you feel the need to, right, and do it properly. Sometimes we do it wrongly. The first time I did it wrongly, right? So it can happen to anyone. Okay, after you're done with the test, again, the plastic bag, throw everything inside, seal it with a Ziploc, right? And put it into the box, the empty box now, and dispose it into the bin. So make sure you don't leave it lying around where others may access it, like little children, your elderly parents, they can access it and end up, if it is a positive sample, you may cause infection.
Great. That is quite a lot to chew on. Now, just for the benefits of our audience, so before you start, choose a properly ventilated place. Make sure nobody's around you. And if you are assisted by someone, make sure that person is properly gloved, shield, mask, and wear an apron if possible. And then read and watch the video again and again until you are sure.
Yes.
But don't open the test kit first, okay? Then after that, make sure you wash your mouth. And if you are a smoker, don't smoke before that. Make sure the sample is viable. And then you conduct a test and make sure you set the timer and read the test at the appropriate time.
Yes.
And disposing is very, very important.
Very important.
Yes, the fact that you are testing it because you suspect there is a case. So if, let's say, you're positive, then you don't want other people to catch it, right? Yep. So now that we have gone through all that, I just want to remind everybody that I'm sure you have questions that you want to ask. Pop it over to Q&A and we will accumulate the questions and we will screen them over and ask Prof at the end of the session. So please do that and not put in the chat room, but put in the Q&A panel. Thank you very much. Now, of course, Prof, I just want to ask this question. Let's say once you, let's say you have collected your samples, how long should you, meaning like will the sample expire?
Right.
Collection, yeah.
Meaning which one? Your saliva or?
Yeah, the test kit. Sorry, the test kit.
The test kit, yes. Right? Yeah. It's just only meant for one use, right? So if you have used it, you have to discard, and if you want to do the test, you need to redo again, right? Okay. As I mentioned before, it is best if you are a close contact or you are symptomatic. That would be best person or time to do the test. And for instance, some people are. I know there are some companies like that as well now. I know one company requires the staff to do the test weekly because they want everybody to be safe for the working environment, right? So there are some companies that do that, and some have asked me what would be a good time to repeat the test again, right? If you have negative Monday, when should I do another test? Because now you go out, you're not sure whether you're exposed to the thing, and sometimes we are not even sure when was the exposure and who is the source, right? So if you are that kind of person, are very careful, and you wish to know, maybe a good guide would be every third day you could do a test. So Monday, Thursday, but it will cost you a bomb, I think, over time. It'll be quite expensive.
Sure. Now that, Prof, we know that the accuracy of these test kits are quite high, but is there any way that pre-existing health conditions might influence the test results? Yeah,
we can have tests that results that are called false positive, meaning you don't actually have the condition, but your result turns back as positive. That's one, right? On the other flip side, you could have a false negative. I mean, you have the infection, but the test tells you it's negative. So I told you, let's talk about the false negative first. Most of the time is because you either tested too early before the viruses get enough, they are accumulated enough in your system to be tested. Sometimes it's just too early for us to do the test. It could be a wrong, method of doing, not enough saliva, not enough shaking of the tube and all that. So that can give rise to a false negative. Whereas false positive can happen when what we call as cross reaction. Some other pre-existing conditions in your body may actually cross react with the test and give you a false positive. Means you don't have the infection, but somehow the test kit tells you you have the infection, right? I do remember one of my former students who went and did the HIV test. They're also quite similar, and it came back as positive, and there were a whole lot of drama because he was very upset about the result and all that. And he says, I don't have any risk factors. It turned out as we investigated what was going on, we believed that he didn't have any risk factors, and it turned out that he had some kind of a parasite infestation in the gut, right? And we believe that was the cause of the cross reaction. So that infection in the gut has somehow caused the test to be positive. And we proved this because once you have treated that infection and we retested him again using the same test kit, and it came back as negative, right? So yeah, there's some cross reactivity. And some people with some autoimmune conditions in the body may give you a false negative, false positive, right? But by and large, these cases are rare. They're not that common.
Right. So if you suspect that you may get a false reading, so the next step will be to go to PCR, right?
Exactly. That's the best. Yeah.
Right.
Always go to the gold standard if you are unsure.
Right. Now, okay, Prof, you mentioned that, a good time to get yourself retested is about 3 days gap. So now, of course, and you also mentioned that people without symptoms should just not get tested. Right?
I wouldn't recommend it. Yeah.
Right. It's not recommended. Now, so what about for people who are like exposed to the environment constantly on a daily basis, for people who can't be working from home, so they have to travel out? So do you recommend them to do the test just for precaution? And how often should they get tested?
I think a lot of times we are testing to sort of for our own peace of mind rather than anything else. Plus, also we are also worried about bringing the infection home to our loved ones, right? Because we are the ones going out every day and they are staying at home, and I might just bring the infection back in. But as I said, if you don't have symptoms, is really the chance of the test becoming positive would be quite low, right? It's actually more useful when you have symptoms, right? I think for people like what you have mentioned, we still need to adhere to the same old, SOP, which we have heard from day one until now, strictly. But if the person really, really wants to test, then again, I'm not stopping anyone from the test, but you need to be aware that most of the time you may not be getting anything meaningful because you don't have symptoms, right? But you could test, like some companies are requiring the workers to test every week. And those days they were using the Rtk. So imagine if you're a worker there and you get your nose poked every week, very unpleasant.
Right. Okay. Now, so the testing, I can see that we have many questions regarding the testings as well. So we'll take that on shortly after. So just bear with us and keep your questions coming in, and we will look at it shortly. Now, so Prof, obviously next step after the Rtk, you're tested positive, and then someone might want to go and confirm it with a PCR. Once you are tested positive, and of course, when you are category 1 and 2 or asymptomatic, people are advised to observe home isolation.
Yes.
It sounds easy, but what if you share the hood with a few people?
Correct.
How do you do that? What are the basic requirements?
Yeah. Well, I have been home quarantined. I tell you, it was a very unpleasant experience. My house is there's just too many people running around the house. So yeah, if you are required to do home quarantine, and these are for several groups of people. One is a close contact. If you're a close contact, regardless whether your salivary test is positive or not, you still have to quarantine. That's the standing order now. If you are a identified close contact, you still need to quarantine for 10 days. Okay, so and my suggestion will require you to check in every day and tell about your symptoms, and there'll be a whole long list of symptoms about COVID symptoms that we need to check in every day. And I did that when I was identified as a close contact, and I had to home quarantine. And from my own personal experience, it was not an easy thing. So I think if you want to consider home quarantine, you have to consider two factors. One is the home environment factor, and the other one is the caregiver factor, if you have a caregiver at home. Right? The home environment, you have to ask yourself, is there a room where I could isolate myself? Now, isolation and quarantine are not quite the same, right? You can be quarantined in the whole house and still not isolate yourself. It's a bit different. There's a tiny difference within the concept. Right? To isolate means I stay in one corner of the house and not come out. I'm isolating myself. Whereas when I'm quarantined, I may be in the same place with several other people. I may not go out of the house, but yeah, there are people moving around me. It's a quarantine. So it's a subset of the quarantine, right? So you gotta ask yourself, is there a place where I can isolate or quarantine myself? And is that room, does it have good ventilation? We know the Delta virus, we say, is airborne, highly transmittable. And one of the strategy now, if you realize our SOP has sort of changed, we sort of say, wear a mask, social distance. Those days we say hand wash, or wash the surface. Now they say, wear a mask, social distance, hand wash is still there. Make sure the ventilation is good. So there are 4 now, right? It's a bit different. So make sure your place has got ventilation. Possibly, if it'll be good if there's an ensuite toilet, bathroom which you can use yourself. And if not, then can I ensure that there's cleaning of the areas in the bathroom? Every time I've used it, I can clean it. I have to make sure. I have to ask myself, can I social distance? When I was being home quarantined, I was wearing a mask 24/7. I don't have an ensuite toilet. I have to come out, but every time I use, I wipe down with alcohol. I was avoiding my mom like a plague because she was wondering what's going on with my son. She's not talking to me. So I was avoiding her. I was wearing a mask. It looks very weird. And no visitors are allowed, right? And you gotta ask yourself, do I have a caregiver, right? Or if you are living alone, am I able to access food and stuff easily? The Grab driver can drop it off the front door, things like that. So you gotta ask yourself, is that possible? There are some tools that are necessary when you are in the home quarantine. Nowadays, you need a thermometer, definitely, to check your temperature twice a day, either the mercury one or the one that points to your head. You can use that. And now we would suggest or recommend everyone to get a oximeter as well, an oximeter, right? And get a good one. I think if you watch video, you get a really, brandless and without verified or certified. You can even get a reading from a pencil. So you need to get a good one, a reputable one, to monitor your oxygen level, because we know COVID primarily affects the lung, and people will have less and less oxygen if it gets more and more severe, right? And also you got to ask yourself, if I deteriorate, will I be able to have transport to get help to the centers or the hospital or the clinic, right? And if you have a caregiver, you got to ask yourself, is that caregiver able to care for me 24/7? That means accessible, contactable all the time, will bring me my food, wash the stuff. He or she has to, wear the protective gloving and mask to get your contaminated clothes to wash, right? And then is the caregiver part of the high-risk group, like an elderly person who is unable to walk properly, or too young, or have high blood pressure, diabetes, they are not controlled. So that put them at risk as well. So you ask yourself, is that my caregiver? If that is, then maybe that's not such an ideal thing to do home quarantine, right? So after you consider all this, then you will decide, yeah, I can do home quarantine for 10 days, right? And then you got to occupy yourself what you do for the 10 days. Make sure you have great internet and Netflix and stuff, right? So yeah, right. But what is the alternative? Well, there are a lot of alternatives nowadays. You have business rooming. They call that the COVID home care. There are teams going around providing for, checking on you and providing cleaning services and also other services linked to food and all that stuff, laundry and stuff. There are some hotels now converting their business to home quarantine business, right? So you can check into the hotel. So your food is taken care of, your laundry is taken care of. And you're basically isolating with nice TV and Wi-Fi, sort of for that 10 days, right?
Right.
So,
yeah. So again, for the benefit of our audience, home isolation seems like an easy thing to do, but do take care to go over the requirements that you have at home, especially when you have the vulnerable groups,
yes.
senior citizens, people with suppressed immunity, and also pregnant mothers and young children.
Yeah, that's definitely.
Yeah. So we want to make sure that, your care, your needs are taken care of, but at the same time to not spread it to your loved ones. So these are, and if let's say really after you evaluate all these requirements and you don't have, you don't meet them, perhaps it's time to look for help and, and reach out, right? So now, Prof, that brings us back. I mean, of course, travel is still restricted, but what about returning Malaysians and, PRs who have to self-isolate at home? Do they have to go through such a strict regimen as well?
Yeah, I know that recently the government has sort of relaxed the rules for people who are vaccinated and returning from overseas. It says you can sort of home quarantine. But by and large, the same rules still apply. I know that because they can travel, they would have tested negative before traveling, right? And that test is usually the PCR test. So at that point in time, so say I'm traveling on a Monday, on Saturday, I give my test and I'm negative, so I can fly on Monday. There's no telling what happens between Saturday and Monday before your flight. You could have caught it and still, be infected. Now that's one of the drawback of a PCR test, in the sense that it can tell you at point that you are infected or not, but you cannot use it for subsequent tests because once the PCR is positive and you test it 2, 3, 4 weeks, even up to 3 months for some people, it will still be positive because the PCR is designed to test for genetic material of the virus. And even though you are cured, you are healed, and there's no more active viruses in your body, the genetic material from the virus may take some time to disappear from your body, right? And the PCR is not able to tell whether this is an infectious virus or a non-infectious virus or so-called dead virus. Then you'll come back as positive, and then we'll have all the drama. So yeah, so the PCR is very good for one at-point diagnosis, but once it's become a positive, it's very difficult to use that subsequently to sort of decide whether that person is still infectious or not infectious, right?
Right. So, Prof, let's go back to home isolation, right? What about those high-risk group, pregnant mothers, elderly, and children even? So, what should the caregiver be mindful of?
Yeah, I think they have to be very mindful of the warning signs. We call them warning signs in COVID. There are several things like unresolving symptoms. That means they are not getting better. They have fever, and then the fever is just going on and on. It's not going away. The cough is getting worse. And then new onset of symptoms means no fever, suddenly fever is there. Not having diarrhea, suddenly diarrhea is coming in. Suddenly you can't smell, so there are worsening of symptoms, right? Increasing breathlessness, right? That's why I say you would recommend you to get an oximeter, because that would monitor the oxygen level in the blood, right? And generally, all of us, if we have healthy lungs, our oxygen should be more than 95% if you use oximeter. And if you monitor that at home and you see that thing falling, anything below 94, you have to be alert that things are not going well. Below 95, sorry, and things are not going well, and probably need to seek help. So for the vulnerable group, I think there have to be a very high level of vigilance in the caregiver to look out for this sign and get help early.
You're right. So, and also the symptoms that we have to pay attention to, which is like sudden onset of fever, diarrhea, loss of smell, sense of smell, and breathlessness. Because this is also to avoid a BID case. For those who are unfamiliar, it's called brought in dead, which that means is too, when the patient is brought in, it's too late to help, right? Okay. Now, so Prof, assuming that, you know, of course, these are the two path here. If during the home isolation people get worse, then they get sent to a hospital. And if, let's say, everything goes well after the 14 days, then what? Why don't we might want to repeat that? So why don't we do the exit test again?
Yeah, we don't do exit tests mainly because it will be positive, right? So they have done a lot of research. They want to find out what we do in the lab is we take the sample from the person, a patient. Not I do, scientists have done it, and they try to culture. We can actually culture viruses in cells. Very tedious, very long process, very expensive process, and they're trying to find out after how many days I can't grow the virus anymore, right? So they have done a lot of experiment with that, and on average, a person who has COVID-19, after 10 to 14 days, we can't grow the virus anymore in the cell culture. What that tells us is after that 10 days now we are using as the quarantine time. Remember, once upon a time, our MOH say 14 days. Now we cut it down to 10 days. And this is supported by evidence, right? After 10 days, we can't grow the virus anymore, which means that person is no longer infectious, right? But if you are to do an exit test, say on the 9th day or even the 10th day, you do a PCR, you get a positive test, right? And if you use that, then you're going to say, oh my God, I could stay on another 10 days. After another 10 days, you do a PCR, again, it's positive, you know. So how long do you want to carry on like this, right?
Right. Okay.
So usually we don't do an exit test.
So if that is the case, then Prof, if let's say someone wants to travel and after quarantining, then they get this test, so what would this person have to do? This is actually a question.
Yeah, I know. I had a colleague my colleague is expatriate, and the wife wants to go back to the country of origin. And unfortunately, she got COVID. And the tests that they diagnosed her with was a PCR, right? And she recovered. And now we know that all international travels, they want you to do the COVID test before testing, and you have to have a negative test before testing. So before traveling, and I told him that it will be very difficult for your wife to travel, because if you do the COVID test now, and this is just like 11th day after the first test, as if you do the test now, it will be positive and they won't allow her to travel, right? So for such people, we have to do other tests, and that would require her to see a doctor, right, who is trained. We have to do other tests like antibody tests, which will tell us that, wow, okay, that look like she's clinically well now. She has a PCR positive, but antibody test seems to suggest that she's already recovered. Probably have to issue an official letter to allow her to travel. But I can foresee there'll be a lot of red tapes for somebody who wants to travel, unfortunately got COVID, PCR positive, and then now want to travel. Just fairly short this time from the COVID would be very difficult to get approval to travel. That's very unfortunate.
Okay, so I guess that's probably, like we'll get more updates as we go along.
Yes.
Okay, so Prof, assuming everything is done, how do we clean up after our isolation?
Yeah, I know. That's a mess, isn't it? again, ventilation is very, very important, right? So make sure, if I was isolated in my daughter's room, so her room is very nice because it has windows on both ends. So if I open both, there's cross ventilation that helps a lot. Remember now, one of the strategy we use to minimize risk is ventilation, right? So now even in my office, I keep the windows open, right? So ventilation is good, and make sure that all the things that you have used, clothes, utensils are all cleaned properly, or disposables are disposed properly. I think the usual stuff, right, should be done before we close the quarantine, or bring the quarantine period to an end.
Right. So now there's just one more questions on, Prof, you have mentioned this before, but we might want to just recap it. What are the essential items or equipment that you recommend a person in isolation have?
You need definitely a thermometer to check your temperature, and I would recommend an oximeter, a good one, to check your saturation. One of the tests you can do at home, I'm not sure whether you've heard of something called happy hypoxia. That's a very unfortunate name because it's not really happy. What happens in happy hypoxia, and particularly with the Delta variant, is that a person is able to perform everyday activities, even though he's positive and the virus is ravaging the lungs, and he doesn't feel it. He doesn't feel like he's breathless, right? Even though the oxygen level is dropping in his body, he doesn't feel it. That's because generally these people are quite young and they have a lot of reserve. They're strong, right? And they don't feel it until it reaches a critical period where suddenly they just felt breathless, and then they have to be rushed to the hospital. We have many cases like this, and they come in at category 3 and above, right? So we sort of missed 1 and 2 and come in at 3 and above, right? So this is called happy hypoxia. And one way to detect is to use an oximeter. You can do a sit stand. What you do is get your oximeter reading first and see how much is it, say 98%. And then get a chair, time yourself for 1 minute, and you stand up and sit down, stand up and sit down as many times as you can, and then recheck your saturation again using the oximeter. If there's a drop, say below 95, or there's a drop of more than 4%, you should probably seek help. That there is something not right with your lungs, because your lung now is not able to compensate for that activity.
Right. Okay. So now that is most of the questions that we have. Now we're going to take on some questions that we have on the Q&A. Prof, for PCR, Rtk, and antibody tests, do these tests detect all strains of COVID-19, including probably Delta?
Right. To know, that there are a bit of different things. One, it's just like going to a how do you say, a dog pound. You go there and you see a lot of dogs. They're all dogs, right? And to detect a dog from a cat is very easy. A dog barks and the cat meows. So it's fairly easy. But then to identify the species of the dog is a little bit of difference. I need to look closer, right? Similarly with the tests that we have, the tests that we use to diagnose don't tell us what variants we are getting. Okay, it just tells you got a COVID virus. It doesn't tell you whether you got an alpha, beta, gamma or delta. It doesn't tell you that. And to know that, we have to do more tests, right? Specific tests we call genotyping tests. We need to know what is that mutation in that virus, and then match it to the variant. All right. That's why you see the reports from Ministry of Health. You see the variants. They come out a bit later compared to, they tell you how many cases per day, and then maybe a day or two or several hours later, the variants, they'll tell you how many Delta are there. I can see that the Delta variant is being reported only weekly or so. right? Because it takes time and specific labs to do it. We can't do it in every hospital, right?
Right. Okay. So now another thing is, I'm just going to go according to it.
Sure.
Will using for this is on RTK test kit. So will using mouthwash affect the test result from Dr. PG then?
If you do it before that half an hour, it should not affect, right? So like I say, make sure 30 minutes before the test, get a good rinse, don't smoke anymore, and just wait. Don't rinse your mouth before the test, right? Probably may affect but we know that viruses are generally not a living thing. So your mouthwash is going to kill off the bacteria, but the virus is not a living thing to begin with, right? But I would not recommend you to gargle just before the test. Again, rinse the mouth, don't smoke, and then do the test 30 minutes later.
Yes. So would actually water be just sufficient, right?
Yeah, sure.
So, okay. Now, if the test show positive, would it be risky to dispose it in the bin? And should it be discarded as biohazard waste?
Yeah, that is one of those drawbacks from self-testing. If you walk on the street, you can see so many discarded masks around, right? And we all know that they are all potentially infective, and we've been told over and over again that we need to dispose of it, but we don't see it everywhere. That's my worry about self-home test kit. If it's positive, and if that person is not a responsible person, he can just leave it on the table or just chuck it and not dispose. I think the self-test kit has a lot to do with us being responsible citizens and be mindful of the well-being of the people around us. So it is our responsibility to dispose of it carefully.
Right.
Yeah.
And we have another questions on if I have visited a place with identified as a cluster, do I need to do the test? And if yes, would RTK is enough?
I work in the hospital, so every day I'm going to a cluster. so I can't be testing myself. Well, like I said, if you have been informed that you are a close contact, then yes, and you are symptomatic, even more so, you should get a test. But otherwise, I wouldn't recommend it.
Okay, so only when you have symptoms.
Yes.
Now, the next one is when do we determine post-infection day? So I suppose this is like once you have got your infection and then you finish quarantining. Is that right?
Yes. So generally for those without symptoms, you have to quarantine for 10 days, and with symptoms, 14 days. So you follow that, and after that you are considered as not infectious, or you no longer.
It's post-infection.
Yeah, there are two reasons why we quarantine. One is to protect others from getting the infection from you, and two, also be mindful that it is also a time for you to rest and recuperate or heal, right? So I think quarantine has got two main points, and we don't stress the first one enough, that it's actually a lot of time for self-care, whereas the other one is to protect others from getting the infection.
Right? So our next question is for those who have been vaccinated, when they do the test, any test, will it be positive then? Right.
Good question. I think a lot of big hoo-ha now about getting empty syringe and no vaccines, and we're not sure whether I got vaccinated or not. Or I got vaccinated, I didn't feel a single thing. Just for the record, some people get vaccinated and don't feel a single thing, and that's perfectly fine. It doesn't mean that you absolutely must have some symptoms. Okay, and some people get it so bad, and then they'll ask whether I got over vaccinated or not. That's another thing. And then you see some businesses now promoting antibody tests to tell you whether you actually got the vaccine or not. But current guidelines really don't recommend using antibody tests to determine whether you are you have a response to the vaccine, because current tests that we have for antibody are designed to detect whether you have had COVID infection, not a vaccine infection, right? So like I mentioned earlier on, for PCR and then now they are well, they want to travel, that will be one of the reason why we want to do an antibody test for them. And then we can tell the immigration and say, look, this person has got evidence that he has responded, he has had COVID and responded and now well and should be able to travel safely. So that will be one of the use.
Right. So, and I think this question is quite important, and sometimes we forget. How soon will an infected person show symptoms?
Right. Yeah, the incubation period means from exposure to the first symptom. And we know that majority of a rather big group of people actually have no symptoms whatsoever. And that's why the disease or the infection is able to spread so easily, because people are not aware that they are sick, right? So that's one group. But there are also a number of people who actually develop symptoms, right? So the incubation period between exposure and the first sign of symptoms is around 5 to 7 days from the exposure, right? So it's again very hard to tell, exactly if somebody says, oh, I've only been exposed 5 days and 2 hours, right? So am I in that danger group? It already really depends on how much of viruses you got exposed to, right? If somebody coughs in your face and a big sneeze into your face, and then you get a big dose of virus, you probably show the symptoms much earlier, and compared to somebody who got a smaller dose of the virus. And again, also depends on the immunity of your body, right? If you are not that strong, you may develop the symptoms earlier. So it's really very difficult to say. Yeah.
Right. A lot of times COVID patients are not serious and to self-quarantine. Will Prof able to recommend any medicines during home quarantine for patients with mild symptoms?
Well, I think there are no, at the moment, there are no proven medications that would help. I know there are a lot of remedies being promoted around, but from what I'm aware, or what I know, the evidence to support whether these medications would benefit is they're not strong. So I personally would not recommend it. I was home quarantined. I was never positive, but I was home quarantined. I was just going on as usual. I take my food as usual. I drink whatever. I take some of my supplements as usual. But other than that, there's nothing really special that you need to do.
Okay. Now, the other thing is, so how long will the PCR test be positive after recovery from COVID? Very long, right?
Oh, that one is the $100 million question. We have studies that reported it can be as long as 90 days. So it's really very long. But some people sort of become PCR negative in a matter of 2 weeks, after the infection. Some people will continue with, we call this viral shedding, continue to have positive tests for weeks and months down the road. So it's very, very difficult to say. So it can be as short as 2 weeks. It can be as long as 3 months.
Right.
Yeah.
So, and then the other question is, should people do antibody blood tests to check for immunity after vaccination?
I think I responded to this earlier. Current tests are not designed to test for responses to vaccine. That said, I've read that newer tests are coming. They are now making tests. So when you go for this type of test, you really have to ask the person who's providing the test and say, what exactly are you testing? Are you testing for vaccine, or is it because of a past infection? I have to be clear. Is there a person in your center that will be able to advise me, who knows what's going on, and advise me appropriately what my test result means, right? So sometimes after vaccine and you test, you cannot positive and you go, we are not sure whether, is it because you actually had the COVID before that and you are asymptomatic, you don't have symptoms, you're not even aware of it, and yet your test positive. But actually, you may not have gotten it may not be a response from the vaccine that you gotten, right? So it's very hard to tell for the moment.
Right. And the other thing that we wanted to touch on is it advisable to get an oxygen concentrator for a COVID positive? And another thing is, do people need to get oxygen tank.
Stock up, huh? Just in case, isn't it? Yeah. Well, as far as I know, oxygen concentrators have two things have happened. They have gone out of stock in the Klang Valley, and the prices have shot up by 5 to 6 times, right? So very, very expensive now, is even better than gold, I think. And then people are buying, right? I don't have an oxygen concentrator at home, right? Certainly do not have an oxygen tank. But I would think some people are cautious, and I can understand, especially if you have an elderly person who have pre-existing problems like diabetes, high blood pressure, lung problems, chronic smokers who, when they get COVID, they may not, they may not tahan so well, and we know that in the Klang Valley, it takes several days sometimes before you can get admitted into the hospital because there are just so many patients and the hospital cannot cope. So in that kind of scenario, an oxygen concentrator may be a stopgap measure for whoever got infected to have oxygen at home before there is a place for them to be admitted in the hospital, right? I will not recommend somebody to carry on with the oxygen concentrator at home and not go to the hospital, right? Please don't do that. Don't endanger yourself. Don't endanger others. The moment your oxygen level in the blood is less than 95, I think you really should try and seek help as soon as possible. But the oxygen concentrator may be useful while you're waiting for help to arrive. But it's expensive, I must say, very, very expensive. So,
okay. So I am looking at this question for patients with who were never diagnosed with COVID-19 but presented weeks after a URTI episode with long COVID-like symptoms. Which test would you suggest we order?
So they have never had COVID before, and they have a URTI, means upper respiratory tract infection, and then after that having symptoms that are similar to long COVID. Long COVID is another thing that we are still trying to understand the full spectrum of it. We know that for many people after COVID, they have this ongoing lethargy, they are having headaches, they can't really mobilize themselves so well. Some of them have persistent short of breath, and that goes on for weeks and months, right? But these things are not uncommon, because even with any typical virus infection, you can have what we call post-viral symptoms or syndrome, right? And you present exactly the same way. I remember when I had dengue for the second time, very unfortunate, and it was very bad. And I had post-dengue syndrome. Dengue is a virus as well. And I was out for the longest time, a couple of weeks. I couldn't really walk properly. I was tired all the time. I had aches and pains everywhere. So it's really very hard. So back to your question, what test would be good? I guess one test we could do several weeks down the road. It's very difficult. You may not want to do a PCR, may not give you a good answer. For that type of test, you probably may help by doing an antibody test or serology test to tell you whether you've had a COVID infection some time back. That may help.
Right. So, and then the next questions we have is, with the emergence of new variants such as Lambda and Epsilon, it has been found that they may be resistant to its vaccine. With that, the topic on the third booster shot has been widely discussed by many countries. Is this effective as a form of, as a form of added protection?
Okay, Lambda now is the new variant of interest, VOI, and it's not been detected in our country yet. It's predominantly in Peru, South America, and it has spread to more than 30 countries, but luckily is still not here yet. I guess it's a matter of time, right? And similarly with the Delta, well, they found that the Lambda is highly transmittable, but not as transmittable as the Delta, right? Let's just focus on the Delta. We know that the vaccines that we have are still effective. When I say effective, I don't mean you won't get the Delta variant, All vaccines, when if you read the manual carefully, it doesn't say we will protect you against the infection. It doesn't say that. It says we will protect you against ICU admission, hospitalization with severe cases and death. We protect you against that, but we don't protect you against getting the infection. What this means is once you get vaccinated, you don't think that you are invincible. Actually, you are still vulnerable. That's why we still ask people to wear masks and all that, right? Similarly with the Lambda, if it ever comes to Malaysia. So, but we also know that the efficacy of the vaccines that we have now, Pfizer, Moderna, whatever, right, towards the new variants tend to be less compared to the original virus that's unmutated. But nevertheless, it's still efficacious, right? We don't know much about the Lambda yet, right? But there are talks now of booster shots, like you asked in your questions. And some countries like Israel, they are already administering booster shot, but not for everyone. They are administering it to vulnerable groups, people who have an immunity problem, people who are immunocompromised, or people who had organ transplants, people on chronic steroids, things like that. Those group of people, even before the virus or the pandemic, they are already a vulnerable group. They are very at risk of infection. So they are giving the booster for this group of people, but not for everyone.
All right. Okay, so thank you so much all for your participation. Unfortunately, we won't be able to take all the questions due to time limits, but just before we wrap up, Prof, any take-home message for our audience on COVID-19 testing and home isolation?
Right. I think same old thing, it may sound like a broken record. The SOP must be followed. And if you want to really test yourself, then ask yourself, is there an indication for me to be tested, right? And if you want to test yourself, make sure you do it properly, right? And be mindful that you dispose of the test. If you are using the saliva test, dispose it properly so that others may not be at risk, right? And that's very important. And if you are unsure about the results of your test, always seek help. There are a lot of portals online that you could seek help. I'm with Dr. Us. I'm sorry, I have to advertise a little bit. I'm with Dr. Us, where you can download the app DOC2 US, the number 2 us, and we offer a free, complimentary. That's a very key word. Free consultation where you can ask us anything, and we will be able to assist with you. And if you need help with, say, transport, admission, whatever, just ask us and we will try to assist you, right? As for home quarantine, please remember, yes, it's very inconvenient. It's terrible, horrible 10 days, right? You just have to remember that 10 days is for your own good. You are having some self-time, you are healing, right? Be mindful of your own symptoms. If you get worse, please seek help immediately. But more importantly, your home quarantine protects others. If you are positive, protects the community. So please do it right and do it well. So thank you. I really enjoyed the session. Thank you, Joey. Thank you.
Thank you so much, Prof. So once again, thank you so much, Prof, for taking the time to take us through today's session on COVID-19 testings and the must-knows about home isolation. To all our participants, I hope you will find the session helpful. Please feel free to connect with us on our social media channel through Facebook, Instagram, Twitter, as well as our website. COVID-19 is here to stay, unfortunately. The more you know, the better you are equipped to live a new normal. And we wish you well, and please observe SOPs.
Yes.
Take care and stay safe. Thank you very much.
Bye.
Bye-bye.